Thumb or digit sucking habit, classification and causes. Based on the conditioning of the nourishment, sucking habits can be divided into two types, namely the nutritive and non-nutritive sucking habits. Nutritive sucking habits involve feeding behaviors like breast or bottle feeding that provides essential nutrients. Breastfeeding supports natural nutritive sucking, aiding in oral muscle development and functions. On the other hand, bottle feeding can cause poor masticatory functions and obstruct normal development. Non-nutritive sucking habits, such as thumb sucking or pacifier use, are comforting behavior developed early in infants to self-soothe. These disrupt orofacial growth and development when practiced for a prolonged time. Thumb or digit sucking can be categorized as normal and abnormal thumb sucking. Normal thumb sucking is typically considered a common behavior during the initial 1.5 years of a child's life, after which it naturally diminishes. The habit is called abnormal thumb sucking when it persists beyond the preschool period. Thumb sucking can also be categorized based on underlying cause. In the psychological type, the habit may involve deep-rooted causes associated with neglect and loneliness. In habitual thumb sucking, there may not be any psychological factors, but is just a habit. In the year 1973, Sutcliffe classified the thumb sucking habit into types A, B, C, and D, based on the depth of placement of the digit and contact of the jaws. Type A is seen in almost 50% of the children. Here, the whole digit is placed inside the mouth with the pad of the thumb pressing over the palate. At the same time, maxillary and mandibular oral contact is present. Next, we have type B, which is seen in almost 13 to 24% of children. Here, the thumb is just placed into the oral cavity. At the same time, the maxillary and mandibular contact is maintained. Next is type C. This is seen in about 18% of the children. The thumb is placed into the mouth, just beyond the first joint, and contacts the hard palate and the maxillary incisors. But there is no contact with mandibular anterior incisors. Lastly, we have type D, seen in almost 6% of children, where only a small portion of the thumb is placed into the mouth. Now let's explore the reasons behind this habit. These have been explained by different theories, such as the classical Freudian theory or the psychoanalytical theory, non-Freudian concepts, the learning theory, oral drive theory, Johnson and Larson's concept. Wait, there's more. But before we go further down the rabbit hole, subscribe to our channel.